For over 200 years, the standard treatment for a gunshot wound was to pour boiling oil directly into the open flesh. This is Ambroise Paré, a battlefield surgeon who ran out of oil in 1537 and accidentally discovered that everything medicine had been doing was torture. Welcome back to the lab, my curious test subjects. Today we are talking about one of the strangest medical breakthroughs in history. The moment a young French surgeon proved that the cure was worse than the wound, all because he ran out of supplies in the middle of a battle. Gunpowder changed warfare forever. But the medical establishment had no idea how to treat the wounds it caused. So they did what they always did when faced with something new and terrifying. They set it on fire and hoped for the best. So what exactly were surgeons doing to gunshot victims before Paré ran out of supplies? Let me paint you a picture. The year is 1537. Firearms are still relatively new to the battlefield, and the medical texts of the day, written by guys like Giovanni da Vigo, the most respected surgeon in Europe, all agreed on one thing. Gunpowder poisoned the flesh. The black powder, they believed, carried venom deep into the wound, and the only way to neutralize that poison was to cauterize the injury with boiling oil mixed with a little treacle. In surgical terms, that means they were essentially cooking the wound. Think of it like pouring boiling water on a burn to treat the burn. Completely painless, obviously. Paré was a young military surgeon serving with the French army during the siege of Turin. He had read the textbooks, he had watched the other surgeons work, and when the wounded started pouring in, he did exactly what he was trained to do. He heated the oil until it was scalding, and he poured it directly into open gunshot wounds. Patient after patient. The screaming was, as you might imagine, unbelievable. But this was medicine. This was the standard of care. And then, midway through the night, Paré ran out of oil. He had more wounded soldiers, no more boiling oil, no more standard treatment. So he improvised. He mixed together a gentle salve, egg yolks, oil of roses, and turpentine, and applied it to the remaining patients instead. It was soft, it was cool, it did not burn. And that night, Paré could not sleep. He was terrified. He was convinced that the men he had not cauterized, the ones he had treated with the gentle salve instead of the boiling oil, were going to die from the poison in their wounds. He had failed them. He had broken protocol, and he was sure he would find them dead in the morning. So what did he find when he checked on the patients the next morning? Spoiler, the ones he didn't torture did better. Paré woke early and went to check on the wounded. He started with the patients he had treated with the egg and rose oil salve, the ones he was sure would be dead. And what he found shocked him. They were resting comfortably. They had minimal pain. Their wounds showed no signs of inflammation or swelling. They had slept through the night. Now compare that to the patients treated with the boiling oil, the ones who received the standard, accepted, textbook-approved treatment. They were feverish. They were in agony. Their wounds were inflamed and swollen. In surgical terms, that means Paré had just proven that the standard treatment was worse than doing nothing. He had accidentally conducted a controlled experiment. One group got the torture, one group got the gentle salve, and the group that did not get set on fire did significantly better. Paré wrote in his journal that he resolved never again to burn so cruelly poor men with gunshot wounds. That one sentence changed surgery forever. He published his findings. He challenged the medical orthodoxy that had dominated Europe for centuries. And slowly, painfully, the profession began to listen. Like discovering that bloodletting actually makes people weaker. Except this, one stuck. Paré went on to become one of the most influential surgeons in history. He pioneered new techniques for treating wounds, amputations, and battlefield injuries. He became the royal surgeon to 4 French kings, all because he ran out of the torture device and had to improvise. The irony is almost too perfect. One of the greatest medical advances in human history happened because a young surgeon did not have enough supplies to follow the rules. The patients he thought he had doomed were the ones he saved, and the ones he treated by the book were the ones who suffered. And all it took was running out of the torture device to realize that setting people on fire was not helping them heal. Medical progress. For 2 centuries, the best minds in medicine poured boiling oil into open wounds because a textbook said gunpowder was poison. In surgical terms, that means they trusted the book more than the screaming. Nobody questioned it, nobody tested it, until one battlefield surgeon ran out of oil and tried something gentler. That accident ended centuries of agony. Paré proved that the most important discoveries happen when you cannot do what you are supposed to do. So here is to running out of bad ideas at the right time. If you enjoyed this dive into accidental genius, hit subscribe and tell me what other medical horrors you want covered next. Until next time, my curious test subjects, stay skeptical